Welcome again. We want to talk about bleeding in pregnancy. And we have bleeding versus spotting in pregnancy. And when we're talking about spotting is when you notice just a few drops of pink, red, or dark brown blood. You understand? You just see it in your underwear or your toilet paper when you wipe. You understand? If you are the type that put on a panty liner or on, the blood won't feel it. You understand? Spotting during pregnancy, especially, is very common in first trimester, and is not usually is not something to be afraid of. You understand? But when we're now talking about bleeding describe a flow of blood. You understand? This one is just a spot that is greater than a drop here and there. You just see that this one is not just a drop, and this amount requires you to wear a pad or a panty liner to keep it from ruining your underwear. You understand? You don't want to ruin your underwear you are wearing. That is bleeding. So there's difference between spotting and bleeding. But an average individual will say, "Hey, I'm bleeding," and you should call your pregnancy care provider either way and tell them about it. They might want to schedule an appointment with you, or confirm that everything is okay. You understand? Both of the ways, either it's spotting or it's bleeding, is not something that you keep quiet. You should talk to your healthcare provider. Then we have some of the possible causes, and the possible causes we are going to be classifying them according to the trimester. And when we're talking about the first trimester of pregnancy, is the first 3 months. The second trimester is the second 3 months, like that. And when we're talking about the first trimester, the common thing there, bleeding or spotting in the first trimester, is the time that is very common. And that's it. That we have about between 15 to 25% of all pregnant people at this time we experience bleeding or spotting in the first 12 weeks of pregnancy. Even though it is common, like I said, you should let your healthcare provider know, so that they'll be able to dictate if there are underlying causes. You understand? So that there will be adequate prevention to prevent any underlying problems or problem that is arising already. Then some of the causes of bleeding in the first trimester of pregnancy, we have one, implantation bleeding. And when we're talking about implantation bleeding, this is when the fertilized egg implants in the wall of your uterus. You understand? And the process of trying to implant itself causes light bleeding. That is the first 12 weeks of your pregnancy. Number 2, we have hormonal changes. The extra hormone you need for pregnancy at times to sustain you can lead to spotting, which is not a problem. Most of the time it can be because of the excess hormone, the excess secretion of that hormone that can cause it. Then of course there's something we call cervix. Cervix is just like the space between the vagina and of course the uterus, is the one that opens when the baby is about to come, that the nurses or the midwife is saying 1 centimeter, 2 centimeter, and all that. You understand? When the cervix, because of pregnancy, there is a change from the way the cervix used to be, and it becomes more sensitive as it passes through the process of pregnancy with you. It prepares for pregnancy with you, because that's the passageway for the baby to come into the vagina, except it's 2-3 years. And the sensitivity of this cervix at that time could lead to bleeding more easily. You understand? Then of course another thing is ectopic gestation. When a pregnancy is formed outside of the uterus, like inside the fallopian, when we look at the uterus, there is a place that looks like hand, and there is a place that looks like two. When the egg releases here, it comes like that, and when the egg comes into the tube, it's supposed to come inside the endometrium, which is the internal place of the uterus. But if there is a problem and the egg decides to stay within this place, which is like a tube, we call it fallopian tube, it results into ectopic gestation or ectopic pregnancy. And of course it can be life-threatening, especially when it ruptures. We call it ruptured ectopic gestation. There will be bleeding most of the time. If you don't take care of it, it can be life-threatening. At times they need surgery, immediate surgery. Then there's something that can cause bleeding in pregnancy. We call it molar pregnancy. It's a very rare condition, though it happens when the egg implants in your uterus, but a tumor forms instead of the fetus, is the tumor that is there. And this also can lead to bleeding, and you think you're pregnant. That is why I say, by and large, you should be able to see your doctor. Then there's something we call subchorionic hematoma. When we're talking about this, there is blood that forms between the amniotic sac. That the amniotic sac is the thing that covers the baby and the uterine wall. You understand? It typically goes away without causing more complication. But you see something, you see any bleeding, please see your doctor. And there's something we call cervical polyps. It's just a non-cancerous growth of the cervix, just at the mouth of the cervix, that bleed in pregnancy. This is due to higher estrogen levels. You understand? Then of course something we call infection. It can be chlamydia, it can be gonorrhea, or various sexually transmitted infection, or even urinary tract infection, the urine that carried the tubes that carry urine before it comes outside the body. It can be infected, it can be due to sexually transmitted infection, and it can be, if it's urinary tract infection, it can cause light bleeding. That is why you need to see your healthcare. Your healthcare provider will be able to prescribe you with antibiotics to treat this infection. Then of course, if there is miscarriage is the loss of pregnancy before 20 weeks. That's the second trimester. It usually starts as light bleeding, you understand, and gets heavier most of the time. And most people also experience strong cramping, that is abdominal pain, you understand. And what are the most common causes of bleeding in the third trimester? In the second or third trimester, number one, the sign in those period may be a serious, an underlying serious condition. So you should let your healthcare provider to know if there are complications, so that they can do something about that. And one of the things that can happen in that is placenta previa. You understand? When the placenta covers all or part of your cervix, it's the cervix that is supposed to open so that the head of the baby can come out. But now there is the placenta covering that side. It's a very serious condition and has to be taken care of immediately. And we have placenta abruptio. And when we're talking about placenta abruptio, it's a rare condition when the placenta detaches from the wall of your uterus. It just, this placenta is what gives the baby like immunity, gives food, feed the baby and all that, and detaches from the wall of the uterus. It can be dangerous for both the mother and of course the baby inside the belly. So we have to be proactive about it. Preterm labor, when somebody is going into early labor earlier than 37 weeks of pregnancy. Then other symptoms of preterm labor might be early contraction, cramping, or at times you see your water breaking. Labor, when you are going to labor after 37 weeks, can cause you to bleed too, because it's not yet term. Then incompetent cervix, when the cervix is not the normal way it's supposed to be, that can lead to even miscarriage too. Then when the cervix just open too early, the cervix is not open, it's like a lip like that until the baby is ready, and it opens too early, it can happen. Then at times you have bloody shoal, light bleeding mixed with mucus that occurs toward the end of your pregnancy. It can be a sign of labor, so you have to talk about it. Then a stillbirth that occurs when you lose pregnancy after 2 weeks. Then what are the other causes of bleeding during pregnancy? Other causes of bleeding during pregnancy that are not related to health condition are sex during pregnancy. So people experience light bleeding after sexual intercourse. This is due to blood vessels in the cervix, because the cervix is receiving more blood flow and is being more fragile. The whole of our uterus during pregnancy needs blood, so that for the benefit of the baby and the mother. Then at time maybe you have pelvic examination or ultrasound scan. Your cervix can bleed after a pelvic examination or a transvaginal ultrasound. At time it might be a pap test, you understand, that they do to check for cervical cancer. Pap smear in your first semester of pregnancy, it is possible. This can cause a little bleeding. If there is injury or trauma, falling or taking a blow to your abdomen, it could cause abruptio placenta. The color of your blood is the color of your blood is your blood brown, pink, or bright red. The consistency of your blood is it smooth, thick, or watery? Does it contain clots or mucus? How much blood there is? Did you see a few drops, or it happens only where you wipe? Or are you feeling a part? This detail can help your doctor in diagnosis. See you in the next video.